important tradition which was started 8 years back to honor the international heroes, and how the AIOS wants to acknowledge them in this podium for everybody to recognize their work and the commitment. I would like to call upon seniors here to congratulate and hand over the certificates to all the awardees. We have 89 this time, or 91 this time. And that roundly, we will like to ask Dr. Prashant Kar to come here, Dr. Prashant Bhawankule, Dr. Rohit Saxena sir, Dr. Natarajan, Dr. Mohan Rajan here. So you may, I think, can stand, I think. Anyway, you have to. So we will start with a small video made by, acknowledge, I think a big round of applause to Microvision for conducting this so beautifully for 8 years. And all the awardees, if you have your family members or anybody whom you want to bring into the stage, please do, because this is something which you share with everybody. So I just like to play this video. Thank you, AIOS, for creating this platform to respect and honor all the awardees. So we'll start off with these are all the people involved. So Dr. Ankita is here. Yeah, she has to, yeah. Next one is right.
आजा जिंद शामी आने के तले, आजा जरी वाले नीले आसमाने के तले। जय हो, जय हो।
Let's call upon Dr. Rolika for her work on Bharti Heda for a travel grant in Singapore, Malaysia joint meeting.
आजा आजा जिंद शामी आने के तले आजा जरी वाले नीले आसमाने के तले
Dr. Aditya Kelkar for his consistently winning the Brett Buckler Award for the Best Surgical Video of 2023 in US. This for the fourth time, so we need big round of applause.
आजा आजा जिंद शामी आने के तले आजा जरी वाले नीले आसमाने के तले
Dr. Aditya Patil for winning the Narsingh Rao Award for the best paper at the Emirates Uveitis and Retinal Update. He's a practicing uvea specialist. One minute.
आजा आजा जिंद शामी आने के तले आजा जरी वाले नीले आसमाने के तले
Don't disturb me. Dr. Aditya Sethi. For his best paper and in traumatic pediatric cataract management. Dr. Advita Nag for winning the John Gabby Research Day Prize at the Toronto University of Toronto.
आजा आजा जिंद शामी आने के तले आजा जरी वाले नीले आसमाने के तले
Dr. Amar Pujari. Dr. Amar Pujari is here. Anybody can take it on his behalf. We'll move. Dr. Amit Kumar Dev for his runners-up at the South Asian Academy of Ophthalmology 23. Dr. Ankita Aishwarya for the best video. Remember her coming with a baby, which was just a few months old, few years back. Nice to see her climbing the stairs up. Dr. Ankita, I think some of us will see you. You coming for your child's India Hero Award maybe in maybe 2 decades from today. All the best. Dr. Anushree Patkal, and she will be accompanied by her mom, she had a very big hand in her growth. She won the travel grant, best paper, very, very good researcher. I think it's a wonderful moment for both of you. That's a mic which Ashok is carrying. If anybody wants to speak, anybody wants to say anything, any of the awardees want to say, you can just take the mic and say something about your paper or... I said that there's a mic which Ashok is holding, and anybody wants to say anything, you can use the mic also.
Only thing I will speak, Rohit, on your behalf. This is a wonderful session. Both of us started, but thanks to this man who agreed. You see, I was getting a lot of WhatsApp communications from various groups that such and such. It started with Susan actually. She won award there, won award there. So I thought I, as Chairman of the Scientific Committee, am incompetent, that not able to honor all these people or adjust them in their program. So I thought I rang him up and that we will have a separate session for this achievers of AIOS who are doing proud to AIOS body as a whole internationally. So therefore we labeled this session as International Heroes of AIOS. And further this thing was, then I approached Mr. Ashok and he after a couple of meetings, he agreed that he will do a wonderful job. And I'm so happy, Ashok, that you have helped. Second part which Rohit added was people who have consistently been doing. Say today, Arvind is an international hero, tomorrow he has not done. So, but there are people who have year on year done something. So we thought we should do something extra for them. So as to facilitate more achievements, maybe a cash award also, so as to they can attend international events. So that is the job of AIOS.
The cash has stopped, sir.
Cash is lost now. Yeah, good afternoon everyone. And then let me say this. It all conceived in one day in Dr. Lalit Verma's cabin, small cabin there. And at 1 minute, immediately we all decided, he contacted Dr. Rohit Shetty. And we said, we have to honor people who make India's flag flying high at international soil. There was no award like that. We agreed that movement and then this award started off and now we are in the 8th year of this award and going very strong. So I'd like to say thanks to Dr. Rohit Shetty as well as Dr. Lalit Verma for this and the AIOS also.
Welcome, sir. And like I said, Ashok will be standing there. If anyone wants to say anything after take the award, please take it up. Dr. Apurva, for her August Tuteman Award for the Best Surgical Video at Euretina 2023, Amsterdam. Namrata ma'am, please. So, Dr. Apurva, what was this video about? If you can just tell us what was this video about in briefly. Ashok, you can ask somebody to stand there so that it will not
So this was the inaugural August Duteman Award at the Euretina. This was the first year, that is 2023 was the first time it was instituted for
So
best paper, best poster and best video.
Fantastic. What was the video on?
The video was on pediatric retinal detachments, trials and tribulations in complex surgeries.
Wonderful.
And the special part of the video is not a single surgery went well. So all the 5 surgeries didn't go well.
Very well.
And they were all complications. I think that's
Wonderful.
what they
Big
wanted
round
to
of
see.
applause for showing something which is not perfect. Dr. Apurva is here. Yes. For winning the APSCRS travel grant.
आजा आजा जिंद शामी आने के तले आजा जरी वाले नीले आसमाने के
Dr. Haripriya, ma'am. Best paper cataract at AO.
आजा आजा जिंद शामी आने के तले आजा जरी वाले नीले आसमाने के तले
He's all there, no? Arvind is there.
Maybe he'll be last.
Allava, they're going by last name.
Last name.
Last name they're going.
Sorry.
Ma'am, what was your paper on at the AO? Because
yes.
winning a paper in AO is very special. Getting accepted itself is challenging because there's only 5 papers get accepted in every session.
Yes. It was the Arvind pseudo exfoliation study, a prospective study, over 10 years follow-up, 1,500 patients.
Dr. Arvind Moria, for multiple things, for
आजा आजा जिंद शामी आने के तले आजा जरी वाले नीले आसमाने के तले
So this is 4th year in a row, so it's a great feeling. Thank you, AIOS, Lalit sir, Rohit Shetty sir, for this opportunity. I'm really blessed. And I would like to congratulate Dr. Prasanna, he is here. So I think in 21 or 22, I won 8 international awards. So he has won 10 international awards this year. Many congratulations to him. Thank you.
Thank you, Arvind. Congratulations.
So Dr. Ashok Kumar Singh for his Best Presentation Trainee Award at United Kingdom for a Pediatric Glaucoma Society meeting in Jan 2024, very recently. Ashok, what was your paper on?
It was comparing the visual field which is not available for the pediatric age with the adult, and just to formulate a normative data for adult age group.
So you used the virtual perimetry.
Sorry?
Did
Yeah,
you use a virtual
visual
perimetry?
perimetry.
Congratulations.
Thank you.
Dr. Atul Kamath, Trainee Bursary Award of ESCRS 2023. The bursary award in ESCRS is given to a paper which gets one of the highest. Come, please come. So what paper did you present at the...
So it was COVID-related times. That time we had done a study on the nursing staff, the knowledge assessment of their eye care. So that's what we did.
Very good.
Thank you, sir.
Dr. Bharat Gurani for many things, for the Oration Award of Ecoin International Conference. The youngest ophthalmologist and only third Indian to be included in editorial board of clinical ophthalmology, New Zealand.
आजा आजा जिंद शामी आने के तले आजा जरी वाले नीले आसमाने के तले
I just want to thank AIOS and thank Rohit Shetty sir, thank Lalit Verma sir and all the jury here to promote this. And I always thought 2-3 years back, can I get it someday? So today, like, it's a dream. Like, this is second year we got it, and it always motivates us to do more. And I also thank AIOS for the travel grant we get every year. Thank you so much.
Thank you.
So in any case, there are 60 travel grants available. You should all apply to Namrata Sharma. She'll be too happy to sanction those. 6 travel grants are there. Chal, congratulations. So this is, yeah, next.
Dr. Bharati Megur. Dr. Deepak, do you like to join her?
So 60,
Or you are also one of the... She can join you then. Both of you can come up. So I think they've been
no, you
really...
come first. No, why are you? You come first. नहीं उनका होने दो ना ठीक है वैसे.
She will join you when you win.
Dr. Rohit sir has already announced they can come with their family.
So he's been consistently winning awards for more than, I can think of more than 2 decades now. And wonderful videos, wonderful teaching sessions. Thanks for everything. So it's already written here, the award is for the anterior vitrectomy in cataract surgery. Thank you. Dr. Brijesh Thakkar for his poster award at APVRS Congress at Hong Kong. Thank you, Brijesh. Dr. D. Ramamurthy for being elected to the very prestigious Triple IC Club. This club is important because anybody from his behalf, anybody, Dr. Natarajan can take on his behalf, I guess. Triple IC Club was started by Ridley, so it's a very old club and very difficult to get in, and it takes some efforts of work to be included into this club. Dr. Debraj for oral examiner to the board of American Academy of Facial Cosmetic Surgery. Thank you. Dr. Deepak Megur.
I just wanted to say
1
something.
minute, yes, 1 minute.
I entered ophthalmology to get into facial plastic and facial cosmetic surgery, and it's been a long deal getting there. I became American board certified in facial cosmetic surgery in 2017. I'd like to take this opportunity to thank my alma mater, Shankar Netralaya and LV Prasad Eye Institute, because of which I ended up getting into facial cosmetic surgery. The first person from Asia to be a diplomate of the American Board of Facial Cosmetic Surgery, and now to become an oral examiner, actually accrediting American doctors to get into this particular field. It has been absolutely amazing. Thank you so much for having me here. It has also been a very interesting year. I became the Governor General of the American College of Surgeons in India. 13,000 surgeons of the ACS. Many of us are fellows of the ACS or have a FACS in front of our names. I became the Governor General, and from the ACS, I'd request everyone else in the audience to become a fellow of the American College of Surgeons and make us the strongest chapter globally. Thank you so much.
Thank you. Dr. Deepak Megur for his win, Film Festival, When Loss is More. Big round of applause for him. Dr. Deepak Mishra for his best paper in South Asian Academy of Ophthalmology, Maldives. Dr. Devesh Kumawat, are you here? Anybody can take on his behalf. Go to the next one. Dr. Divyakant Mishra is here for Best Retina World Congress surgical video, and also for his above Young Ophthalmologist Rising Stars program. Divekant, what was the video on? On the best video one the one you won at the Congress?
Hello. So the video was on management of a case of a subretinal cysticercosis, submacular.
All the best. Dr. Ekagrita Shukla. Okay, I'll call. You're here? Please come. Dr. Ekagrita Shukla. And for the best paper at the IMSICS Congress and also at Maldives. So we'd like to call upon Ramurthy sir for being one of the few in the country to be inducted into the IIIC Club, the International Intraocular Club. Big round of applause for his request Dr. Partha Biswas to be on the stage, please. Thank you, sir. Thank you. So we have Dr. Professor Heg Anku for Film Festival winner of the World Glaucoma Congress 2023. So what was your video on? You can just briefly give a...
Sir, it was on surgical rescue techniques in post-trabeculectomy hypotony.
Because it wasn't diagnostic, so what diagnostic modality did you portray?
No, sir, it was just the rescue tech, surgical ones.
Okay.
Yes, sir.
Thank you. Dr. Harsh H. Jain, are you here? So it's not here. Anybody can collect on his behalf? For his travel grant at the Asia Pacific DRS Society. One thing we just wanted to clarify is travel grant is always given to the best paper based on the review by the reviewers. So, it's like an award for your paper. Dr. Harshit Vaidya for the best poster in APAO, Kuala Lumpur, Malaysia. Dr. Harshit, what was your poster on? Very
Sir,
brief.
it was on smartphone fundus imaging, the 1-year experience of a new VR surgeon. So it was about 400 cases, consecutive cases.
Wonderful. Dr. Hemant Murthy, sir, is here. He's been an inspiration to all of us in Karnataka and Bangalore for his phenomenal work, both as a clinician and also in his dedication to social service. And he's, for being the image of the year in benign familial fleck dystrophy on Spectralis. Big round of applause for all the work he does.
Thanks to AIOS. Actually, this is the fourth time that I won an international award, but I've never been fortunate to come to AIOS due to some reasons. So this is the first time I'm receiving it.
Thank you, sir. Thank you. Hiranmoyi Das, Dr. Hiranmoyi Das, please with your mother. Welcome. No need to rush. Take your time. Surgical video presentation at 39th APO Congress, Bali, Indonesia. It was a wonderful Congress and nice to have had the best video there. Dr. Hiranmoyi, what was your surgical video on?
Sir, it was on the potential of a general ophthalmologist. I am a general ophthalmologist working in the northeast, Shillong. That is a very far behind, lagging behind us, and there are no oculoplastic surgeon till now. So I am doing oculoplastic surgery along with general surgery. So I want to prove that all the people cannot go to the center of excellence.
Wonderful, wonderful.
So are you inviting us all to Shillong?
Yes, sir. If I can organize something like this, not small workshop also, I will organize you. Hope you will come there.
We will.
Thank you. Thanks a lot. More power to you. Dr. Akida Lal is here. Anybody can collect. Dr. Zai Kelkar. Aditya is going to collect her award. Being appointed on the FRCS Glasgow exam panel. Pune is a new center for FRCS.
So Aditya says it's his daughter's exam and Shah is taking care. Why is Aditya not taking care?
No, I'm taking care by being away.
So, is your center, is your hospital now an examination center for FRCS?
So I think in the coming years they will be starting the FRCS exams in Pune as well.
Yes, yes, I was.
Thank you.
And it's a big tough process to be an examiner because they have to go through multiple levels. A lot of people have to second your candidature to it. So it's a big thing. Thank you. Dr. Joyita Das for Best of Show Award at the American Academy of Ophthalmology. Big round of applause because it's a very tough to get this award. Dr. Joyita, what was this on? It was a video or paper?
This was a video on a new surgical technique of ptosis surgery.
Ptosis surgery.
Ptosis surgery for poor limited function, and I believe that within 2-3 years, now we don't need to do any frontally sling like silicone. It will stop that
Wonderful,
practice.
wonderful
Yeah.
on this achievement.
Thank you.
Dr. Kirandeep Kaur for many things again. The IYK Wiki contest, editorial board of case report, clinical case reports. Just a question, how do you you write papers, you're involved in clinical work, surgical work, and also in that age where you're in the learning phase of everything. What's your advice to the juniors how do you multitask and balance all this? It's very important, but because, this is the age group which is very restless and it's very difficult to multitask.
So, sir, what I believe is this is the age wherein we have that adrenaline rush to do anything
Now,
possible.
how do you, three things you want them to take home from? How do you multitask?
So, first thing is, like, what I would like to say is we should never think that we can do the academical work running away from the clinical work. So
Very
the
good
academics will come with the clinical work. So we need to push ourselves into the clinical work. Academic work will follow. Then, apart from that, sir, I do have a small kid also, whom I have to take care.
He'll be turning 2 tomorrow. So that is the major part where I am putting in my energy. But apart from that, yes, we have to balance. And I think
Bharat helps you in taking care?
maybe
Is he here for the conference?
He's not here. Anyway, thank you.
Kid is not here.
He is not
So
here?
I'll be leaving today because tomorrow he'll be turning 2.
Thank you. God bless.
Thank you so much.
Dr. Kumar, doctor, is here. He'll take later. Dr. Lailil Raj, I think big round of applause. There are few, I think 3 in this group who have won all the 8 times. And anybody from Agarwal's, anybody can take. I mean, it's a very rare thing to have won all the 8 times. All the 8 times, even in the COVID time, they have won. I think even now, I think he has very good 5 awards. Dr. Madhu Uttaraju is here. I did meet him yesterday. Anybody on you can take on his behalf? Again, for winning the American Academy Best Poster. Yeah, please come, please come. Convey our congratulations to him for his, I think this is his 2nd time he's winning this Academy Award. Thank you. Dr. Manju R. Pillai for the best video of the World Glaucoma Congress. I think these are all very important awards because these are all specialty meetings which houses every big name, and winning an award or video is very, very challenging here. Ma'am, what was your video on?
I got a USAID grant for 1 crore rupees to look at the adherence of children who are suffering from glaucoma. So I work in Arvind Eye Hospital, Madurai, in the glaucoma clinic. So we did a field visit during the COVID period to find out why the children are coming for follow-up and why few children, the family are bringing them for follow-up. So that was a very good study which gave us a lot of insight. And we could put all our children who were turning blind into the blind schools and could educate them.
What's one take-home point from your study which clinicians can follow?
Yeah,
Major one.
when we think nothing could be done, there are so many things that we can counsel the parents that they will be very happy about.
What would be the one thing which you'd counsel?
Low vision aids, and visual rehabilitation for the children who are turning blind from the small age itself. We can train them.
Fantastic. Thank you, ma'am.
Thank you, sir.
Dr. Manmeet Singh for the best e-poster at APSCRS here. Yes, come on. Wonderful. Dr. Manmeet, what was your e-poster on?
Yeah, we had done cross-linking in microbial keratitis. It was a poster presentation. This is a ribbon cutting ceremony for me to be introduced at such a big platform. Thanks to Lalit sir and Namrata ma'am, who has always been a motivational sport whenever I met them. And my brother Rupin Dang when he did medical retina from you, sir. And having spent so many years of my lifetime after MBBS in jail department, not as prisoner, but as a jailer in Haryana Civil Services. So I somehow got contact with the Shankar Academy of Vision. They nurtured me and helped me in doing first fellowship in intraocular lenses, and now my boss Sudhakar sir, who is the main person behind this person with wings. So thank you so much, sir. Thank you, AIOS, for such a big opportunity. Thank you, sir.
Thank you,
Rohit, sir.
Manmeet, and your mentor, Dr. Sudhakar, for this nurturing this wonderful work. And PACS, which is the microbial cross-linking, is picking up in a very big way. Dr. Maya, and she is the winner of Best Surgical at the British Oculoplasty Surgery Society at Oxford. Maya, what was this video on?
Yeah, I described a minimally invasive technique to deal the orbital hydrated cyst, multiple orbital hydrated cyst.
And you have, it is something which is designed by you, or it's been you refined it from some other?
Yeah, I refined it, the previously described technique.
Okay, wonderful. Dr. Mayur Morenka for the grant award at the Uveitis and Retina Update Society. So, Dr. Mayur, what was the free paper on for the one you got the award?
The free paper was on post-fever retinitis, and the passion for it is just so that everyone is able to identify that post-fever there can be retinal complications which require steroids.
Anything you want to let the audience know about your work which can be translated to the clinics?
Mostly after fever, about 3 to 4 weeks later, any episode of fever, these patients are presenting with uveitis, retinal ischemia, retinal complications. They can get
Most driven by
mismanaged.
the viral etiology.
Yes, yes.
Thank you, Mike.
And I just wanted to say one thing that at the beginning you said that one could get family over here. So Dr. Prashant Garg is here. He is the head of my family.
When I
the
said
MVP
family, it's your mentor, teacher,
Thank you so
anyone you
much,
want to get. Dr. Naren is here. I think he's presenting in Rangachari, so I'll keep it at the end. So a few of them are in Rangachari. Dr. Obli Ramachandran for the best award at the APVRS. One very interesting thing is the retina surgeons here have won most of the awards for the Asia Pacific, and I mean that needs a big round of applause. Srinivas is here. That just shows the power of good surgery and skill, and amazing. Every award from international thing is from India. So, Dr. Ramchandran, anything you'd like to talk about this video?
Video was about internal scleral rupture, but I mean, this is not an individual award. Everything is a collective. I mean, my head of the department, Lalit sir, he has always been my biggest support. My wife, Dr. Gauri, they both have been my immense support. So that's it, sir. It's not an individual achievement. It's just a collective, and that is what it matters.
Any take-home point from the video?
Take-home point from the video: when you're having an internal scleral rupture after with retinal detachment, you need to be very careful with the oil migrating subretinal space and subconjunctival space. So how to manage it? You have to always keep it in mind. That was what was challenging in this case, and that's what we showed in the video.
Wonderful. Thank you. Pooja is, I think, in the Rangachari. She will come later. Dr. Prasanna, I think you need the second slide next year. Prasanna is also in Rangachari, I guess. But we'll keep him in the last. So we have Dr. Prashant Garg also here. And so for being for many things, but inducted as a member of the International Academia of Ophthalmological Academia of the 5th Indian to be bestowed with this honor. Sir, would you like to say a few words about this, that society, where you're inducted, and why is it so difficult to be, and what you can do?
I think this is a kind of an association of university professors and academicians, and there are only 100 seats that are there. The goal is to promote education, research of the next generation of ophthalmologists, and the selection process is usually when you submit your CV and the sponsorship by 2 of the previous members. You must achieve 60% of members voting in favor of you. That's make it very difficult unless everybody knows about your work in the field, and my work was primarily related to ocular infection, and that probably brought me this. I'll be the 5th person from India who has got this membership.
Wonderful.
Fantastic, fantastic.
And here we have Dr. Prasanna for many, many things, for videos, papers, and also poster awardees. Prasanna, which one of this is your favorite and why?
So the World Glaucoma...
Very specific why. Why, which is your favorite?
So the World Glaucoma Congress grant was my favorite, sir.
So what do you get to do with this grant?
I was able to cover the trip, sir.
No.
Oh, finances was a bit of a thing. But more than that, why I say that is my favorite is I was able to make a mark in the grand rounds. Totally, they selected 6 cases out of the globe. In that, 2 of the cases were mine. So I was able to make a mark in the grand rounds. And I had a record of 11 posters presented along with the 2 videos in the World Glaucoma Congress.
The second question, little uncomfortable question. Which of this is not your favorite and how do you want to improvise on that?
So I would like to...
Which you feel that you could have done better? Because it's important for all of us. Sometimes we get award where we don't deserve it and we think we will learn from how to improvise it. And Prasanna is very good in that.
So I would like to work on my specular microscopy photograph. I didn't expect that endothelial photograph to win actually. The third one, the ACRS award,
so
honorable
how do you want
mention.
to improvise on that?
I felt the quality of that was not very great, sir.
So
Maybe
I'll
have
improvise
to.
on that.
I would like to work on it, sir.
Next year we need the second slide for you.
Thank you, sir. Thank you for the opportunity.
I think we have Dr. Pooja also here. She's an 8-time winner, and I think she has won all the 8 times. Being a mentor, I think I'll also join her. So, quick questions. What makes, there are so many youngsters here like you want to be the rising star. It's not about the rising star by the magazine, it's about rising star in your own practice or your family or whatever. What are the 3 ingredients which you feel they need to have it to become the rising star?
First and foremost is the passion and willing to go an extra mile to achieve that. Second is finding the right mentor. I know I shouldn't say this in front of you, but finding the right mentor is very important. And a mentor-mentee relationship is just like a parent and a child relationship. There will be ups and downs, but I think if you want to do the right way and do the right thing, stick to it. And third thing is there will be days, ups and downs, highs and lows when you are going through this journey. But again, if you want to achieve it, you have to stick by it.
Wonderful. All the best, and we'll wait for the 9th. Dr. Prateek Nishant for Academic Mentorship Development Program by the Academy of APAO. Asia Pacific Professors of Ophthalmology,
Before I put on the shawl, this kid I've seen toddling in the conferences, and I think his education started possibly from Professor Soni Sinha's womb itself.
Wonderful, wonderful.
I dare not say that my family is not here because Partha sir is here, Lalit sir is my guardian, Maurya sir is here, Satyajit sir is here, and my teachers are there in the audience as well as they are supporting me from all around. So yes, this award is for all of them and to my mentor, Professor Rajwardhan Azad, who has supervised this project. And this happens to be my first international award as well, and the first International Hero Award as well. So hoping, I promise the hall that the best is yet to come.
Thank you.
You'll see me again here.
Thank you, Prateek.
Year after year.
Dr. Prithvi Chandrakant, again the best scientific paper award as Asia Pacific Academy of Ophthalmology, APAO, in Kuala Lumpur. So, Prithvi, what was your winning paper on, and how this can translate into clinical?
So this is basically my innovation which I had done IOL scope.
which I took forward to use it in rural India and try to use it where places where microscope is not available.
Wonderful. That's a very wonderful one. And are you writing it as a paper?
Yes,
Publishing?
yeah. We are on the process of writing the paper and
You should do it fast because somebody else will pick it up. And so, Dr. Pooja Maitra for certification on in genetics, essential and genetic testing and sequencing technology. So, what does this entitle you to do, Dr. Pooja? How does it, do you, what sequencing are you testing? How does it translate to
So
use?
firstly, I went from being a vitreoretina specialist to a pediatric retina specialist and now venturing into genetics. I think without genetics, we cannot change what right now our barrier is some diseases, because somebody yesterday told that 50% of the book was non-treatable at one point of time. We are going to change that very soon, and very, very soon.
Thank you. God bless. So, Dr. Punit Jain for Eye Cancer Foundation Award for looking at conjunctival melanoma registry. Wonderful. I think bringing registry to our country it's a very, very big thing. I think this needs about one more round of applause. Dr. Punit, you're creating a registry of it across the country, or you're part of?
Yeah, so sir, it was a multi-center international registry. This award is not a point event. It was actually a culmination of the work that has gone into the compiling the data from the registry. That was a big challenge, and we concluded this registry last year, and the third paper will come out soon in ophthalmology.
Wonderful.
And I would just take a second. So why I've reached here is because of my alma mater, RP Center, and a few of my mentors are on the dais. And I would also like to thank my organization, Sharpsight Eye Hospitals, because they've been very accommodating to my academic schedule. Being in a corporate hospital, it can be a very challenging task to attend conferences.
Thank you
so
Punit.
much.
God bless. Dr. Rahil is here. Rahil is here for many things. I think it's also part of, for the Guinness Book, also for creating the maximum number of surgeries, also become for the advisory board of refractive advisory board. Congratulations, Rahil. God bless. Dr. Reema Bansal is here. He's going to correct on her behalf. For again, poster at the best poster at the Uveitis Society in Abu Dhabi. Big round of applause for her. Thank you. Dr. Ritika Mukherjee, I'll join her again, one of very, very sincere and diligent fellows. And she's come with her father, he served in the army, and with the mom. She, along with Nurima, who is here, with one of our very best fellows, and a lot of the good slides we make are all done by both of them. Very creative, and they make beautiful videos, beautiful work. I think these are the people who will change the way we look at practice ophthalmology, because when they joined, they came here not to learn surgery, because they wanted to join the entire holistic aspect of medicine. They worked on gene therapies, they worked on genetic testing, they worked on everything. And this is how the next generation of students should be, because it's just not about surgical skill can be picked up very fast. But if you, like the previous Dr. Pooja Maitra said, if you want to build the next generation of sequencing, you need people who think that way. Thank you to you and all the people who have taken that leap to do things which is not in your comfort zone. All
Thank
the
you,
best.
sir.
So the poster was for the biomarker work, which has actually turned into a reality this meeting itself, because we've launched the biomarker kit this meeting. I'd like to thank Sir and AIOS so that I could do this with my parents today. Thank you.
And the congratulations to your parents for being so calm, not to disturb you ever. Huh? Yeah, Dr. Himamshu Mehta can also come up as part of the panel to give the awards. Oh, it's your son-in-law also getting it. Rohan, again, one of our very, very strong fellows. One thing very interesting about Rohan is that even after he finished the training, he consistently attends conferences, presents, publishes, and keeps winning and making us all proud. Pooja, you can also come. You are a big support to him in all that he is doing and making. Rohan, what is this film about, and how does it help the practicing clinicians?
So as we know that in smile surgery, the highest complication is your flap tear. So we've basically, with my mentor, Dr. Gaurav Luthra, and I would like to thank him for letting me actually make a video on his idea and use my skills that I learned at Narayan Netralaya, thanks to Dr. Rohit sir, of making a video, and we are able to retrieve the lenticule in totality and decrease the amount of cuts that are there in the lenticule so that it can be further used later as we see in keratoconus.
Thank you, Rohan.
Thank you, sir.
And I'm sure you're attending this meeting this year. We hope to see you next year again.
Thank you, sir. Thank you.
Again, sir, join Rushad with you. And again, Rushad has been winning consistently. This is your fifth year, I think. And Dr. Naushis Shah will join him to collect the award, and the best paper of the PSCRS Singapore. Rushad, what was... Thank you, sir. That's why I came there. So, Rushad, what was this video about, and how do you think it will help us to translate?
So this paper was on ocular surface thermography and how that correlates with neuropathic pain, the pain without stain, which we learned with you. So I'd just like to say a big thank you to AIOS, thanks to my family and my second family in Bangalore. You know who that is.
Thank you, Rushad. All the best. God bless. Dr. Sethi? Yes. You can also join her. We'll take photographs. Wonderful. Best paper at the glaucoma Glaucoma Society on the dawn of MIGS makes an eye stent surgery at Indian scenario. Yes, yes, ma'am, you can also join. 1 minute. Ma'am also is joining.
Madam, you come this side. You come this side. Yeah, the shawl is big enough.
Ashok, you should make a bigger shawl next year because we need to include many people. So she's spearheading the stent and minimally invasive glaucoma surgeries. I was there at the WAS meeting in Varanasi. I think when somebody takes up a new role and they try to spearhead by doing surgeries, live surgeries, they need a second round of applause for this wonderful work.
Thank you so
and
much.
Anything for the audience here about this procedure or this video or this paper which you have won?
So this was basically the first demonstration of the outcomes of iStent and iStent Inject from the Indian population. It has neither been reported nor published anywhere. So I think that is what clinched my paper apart. But apart from that, I think from the lot of fury that we have against MIGS in India specifically, we should understand that as glaucoma specialists or general ophthalmologists, it's always nicer to adopt newer techniques because it won't be very long before we could be held, medico-legally for not offering this to our patients.
Is this,
so I guess for...
Sorry, is this related to because we have more pigments in the trabecular meshwork?
So basically, now in primary open angle glaucoma, we all know that the problem lies in the trabecular meshwork outflow. So what we do with iStents is we place a sort of stent which bypasses the trabecular meshwork completely, and the flow of the aqueous from the anterior chamber into the Schlemm's canal is through the lumen of these stents. So that's the idea.
Thank you, and wish to see you more often here.
Thank
All
you
the
so
best.
much.
God bless.
Thank you for this honor.
Professor Sahil Kumar Mandal for his not mentioned here about thing, but you can let us know. Big round of applause for him. Thank you, sir. The Samina Zamindar is not here. So, yes. No, he has to speak.
Any question?
Yes, yes.
Your take. Actually, I am presented in American Academy 3 papers. One is a last-bearing orbital extension in mucormycosis. At the time in COVID period, we are really working hard and to save the lots of patients, and that is presented in American Academy, number 1 paper. The second paper is impacted point body into the orbit in the children. The children aged less than 2 years, 6 cases, and there's a big point body is removed with a minimal invasive orbitotomy. And the last paper is our 14 French silicone balloon or the silicone catheter used as an expander device in lid reconstruction surgery. And this paper is, my principle is that I have been presented outside, but to be published in India. That is my way.
Thank you. Very good. Samina Zamindar, you will collect on her behalf. She's doing phenomenal work in teaching people about the OT sterilization, NABH, and multiple other things. I think she needs a big round of applause from all the audience here. We have Dr. Kumar Doctor. We missed him. He was in another session. So we'd like to call Dr. Kumar Doctor. Dr. Shaswati Mohan. Dr. Sujata ma'am will come and collect on her behalf. Amazing work, and they also in Uretina. Thank you, ma'am. Dr. Savleen Kaur. Here? Yes, she's not here. You can come and collect it. For glaucoma and cataract award for the best paper in the field of cataract surgery. Dr. Shishir Agarwal is here. Reviewing for the AGO awarded for the 22 reviews between 23 Jan and November 23. Thank you, sir, for helping us to review all the papers. It's something which is many times it's not recognized. I think journals like AJO is recognizing your contribution. Thanks a lot. Dr. Shishir Verghese for many things, best video at the APAO, at the Maldives, South Asian Ophthalmic Society meetings. Big round of applause. Dr. Shivraj is here. He's not here. Dr. Srinivas Joshi for being a permanent member here. Shivraj is here? Okay, 1 minute. For winning, Srinivas, this is your 5th time? 11th? 7th time. I think that needs a big...
And every winning video that he presents and the Red Butler Award that he gets is court-martialed.
Thank you, Srinivas.
Thank you, sir. Thank you. I dedicate this to all my family and my students, my entire staff. The retina surgery takes long, long hours, and thanks for all my staff for bearing my temperament, and Deepthi, my second half, and Dr. Giriraj, Dr. Rishikesh, and my entire fellow. Thank you all the mentors, and thank you AIOS for conducting this session.
Thank you, Srinivas. Dr. Shivraj, please come. For getting selected to be on the Wall of Fame of Retina Rocks of Retina World Congress. Big round of applause for him. Dr. Simar Ranjan Singh, NIH award. I think it's NIH and EI awards are very, very important because it comes with a lot of hard work. The Simaranjan, what was, just quickly, if you can, in the interest of time, tell me what was the area you worked on for this award?
This was the Advances in Pediatric Retina meeting, and I presented on chandelier-assisted external drainage for advanced coach disease for globe salvage.
Thank you. Dr. Sujini Shroff is here. I think I will collect it later. It's okay. Dr. Tanvi is here. Big round of applause for our work on best paper of the session of APS-CRS in Singapore. Congratulations, Tanvi. I think you have won this year also something, right? I think you want water?
What a time to cough. I just want to say, this was a paper we had done for evaluating the intermediate visual acuity in monofocal lenses. But I want to thank you because you've instilled a love of clinical research in me. I was never into publications. Thank you so much.
Thank you. Thanks a lot. We'll see you more often here. Dr. Tushya was here. Is he here? Tushya, please come. Again, somebody who keeps being here from the inception of this award. This is your 5th one. Wonderful, Tushya. Great work. And American Academy, ACRS. Yeah. Thank you. Dr. Tutul Chakravarti is here. Yes, ma'am. A recognition by ophthalmic technology assessment at AIO in December 2023. Thank you, ma'am. Dr. Veer Singh, again from Retina for winning the best video at the Annual Congress 2023 and the best abstract award at the APVRS. Wonderful. Dr. Vijay Rangarajan is here. Yes, quickly if you can just say.
Just wanted to say I have a lot of inspiration from Dr. Srinivas, Dr. Vishal and Dr. Aditya. It was my first ASRS and winning the red buckler in my first attempt was
wonderful. I think that needs a big round of applause. So Dr. Vijay Rangarajan for the Video Oscar Award at the World Ophthalmic Plastic Reconstructive Surgery at Dubai. I think wonderful. Thank you, ma'am. Dr. Vinit Tanwar. Dr. Vinit Tanwar, please come. Please bring your family also. Please come. For Best Surgical Video, Young category at the ESCRS 2023. Wonderful. It's a very, very difficult section to win in ESCRS Young Award. I think we should give them a louder round of applause. Thank you, Vinit, and keep winning. All the best. God bless. Dr. Yugangshi Kush is here. Yes. First place in Best Surgical Video at ESCRS. Again, wonderful. Wonderful to see so many young faces winning in ESCRS. One of the toughest places to win an award, especially in a video. I think Zain, Dr. Zain Katib is here, runner-up at the American Society and ASCRS. Big round of applause to him. Making videos, winning and competing in this sport is a very, very tough job. Thank you, Zain. And he's an innovator also. So quickly, just 1 second, what was your video on?
I don't know if you know this, Rohit sir, but my whole work on this started after I attended your course and I got interested in topography guided LASIK. It's a software that I've made for topography.
Wonderful. He's made a software for Contura. Wonderful work. And I think we'll see sometime if it's available online. Dr. Veena, Grand ASCRS 2023 film. I think this round, big round of applause. ASCRS grand prize is very, very difficult to get. Thank you, Dr. Veena, for inspiring so many young people here. Dr. R. Venkatesh is here. You'll collect from his behalf. Okay. Can just give the shawl, you don't need. I think one shawl is. Again, winning. It was a great time in 2023. A lot of awards for Marvin and wonderful videos. Dr. Kavita. Yes, Kavita, you'll collect? Okay. I think for winning the second prize in the the Glaucoma Congress. Thank you. Swati Upadhyay. Swati also will collect? Okay, she's here. There's no photograph, sorry. Winning the runners-up at American Glaucoma Society. I think all of you need, I think we should clap stronger and harder, even though it's the end of the day. I think these are all beautiful awards. Truly make India shining. Dr. Vivekanandan, Special Interest Category Film Festival. Are you here? You will collect on his behalf? Yes. What about this one? Is here? You're here, please. So, award for the APAO 2023 retroconjunctival cautery for conjunctival calluses. I request Micro to make a platform where they can share their videos or or make a small video about their work. So Dr. Maipal sir is here. Dr. Ritika is here for being felicitated for his work on ACE Award and for many, many, many things.
So Ritika is unique. She's from my alma mater, Lady Harding. Then she did her post-graduation from Maulana Azad Medical College. And then RP Center, MD Ophthalmology, and now Center for Sight. So nobody has this unique, unique placement of being in 4 places. And now you're going to Seattle to do the management course.
Thank you. Vardhman, for many, many things, and also conducting this meeting along with Namrata ma'am. Congratulations. With his dad. Dr. Britika Sen is here.
I think, Rohit, I'd like to make a statement, and it's a real proud privilege for us to know that Dr. Sudha Kankaria, Vardhman's mother, has been nominated for the Peace Prize. So the Nobel Peace Prize, yes. So that's something of a great, great honor and a pride to all of us.
Thank you. Thanks a lot.
Thank you, sir.
Dr. Sheetal Brar is here. I just saw her. Not here. Dr.
I
Aditi
can just make a small comment, Dr. Rohit, about this. Thanks for starting this International Hero Awards, especially to you and AIOC. Taking clue and inspiration from you, we also started in an MOS in Maharashtra Ophthalmic Society.
All state societies
and
should
it
do
is really working well.
Dr. Aditi, for receiving the the Indo-French Collaboration Young Ophthalmologists of India Recognition Award at the Emirates Society of Ophthalmology. Big round of applause, please. Sheetal is here. So let's keep the Sheetals ready, please. Thank you. Sheetal, come. Sheetal Brar again has been here. She's been winning. I think let's give her a big round of applause. 8 times. It's not easy to consistently be there for every win and be part of this India Hero Award every year. And this is a very inspirational. You are all inspirational figure. You, Lionel Raj, Pooja. So we come to the end of it. Any more awards?
We have 2 special felicitations. One, we wanted to felicitate Dr. Natcher ma'am, because this year she's been conferred with Padma Shri. I think the first female ophthalmologist to get Padma Shri. And anybody from Arvind Group is there who can. So Arvind team can please collect on her behalf since she's not there.
I think let's give a standing ovation to this. Not too many times you would see this.
Rahil is here.
Rahil is here.
So, doing 250 Contora vision laser iris surgeries on one single day, Dr. This is a record in itself, and award for him. This is beyond ophthalmology. First Indian ophthalmologist to get commercial pilot license. Please give a round of applause. To fly an aeroplane.
Thank you.
This is special. Leading the historic all-women contingent of Armed Forces Medical Services at Republic Day Parade. We welcome Dr. Major Shrishti Khullar for making the Indian ophthalmology proud. He's from AFMC and Vijay Sharma is the head of Armed Forces Medical College. Thank you, sir. Very good. Keep it.
Like to call upon Ritika again on his behalf of Professor Maipal Sachdev for the leading the team of ophthalmologists into Guinness Book of World Record for maximum number of diabetic retinopathy screened.
Okay, I think they deserve it. Microvision, registering in.
Microvision for registering in Asia Book of Record organized the largest awareness campaign on glaucoma 2023. This participation of more than 2 lakhs individual at 1973 eye clinic India across. On behalf of Microvision, Kumar and his team, I think a big round of applause for Micro for conducting this meeting and also conducting many of these awareness meetings. We come to the end of this session. I thank the AIOS, Namrata ma'am, the president, and all the office bearers for this wonderful opportunity to share the India heroes. Thank you.
We have to thank one person who started it all and who inspires us all, Dr. Rohit Shetty. Hip hip. Hip hip. Hip hip. Good. May we have the next session, please?